Hey everyone, and welcome to today's Explainer. Today, we're taking a really fascinating journey inside the human body. We're going to unpack the mechanics behind a super common yet kind of misunderstood condition, Gastroesophageal Reflux Disease, or GERD for short. We'll be looking closely at the actual medical insights to understand exactly what's happening when simple heartburn escalates into something much more serious. So, let's start with a question I think we can almost all relate to. Why does a heavy meal sometimes feel like a literal fire in your chest? Many of us have experienced it, right? That painful, burning feeling of acid indigestion after eating a bit too much, or maybe having the wrong kind of snack late at night. You feel it right there, burning in your chest. But to really understand this everyday experience, and to kind of ground the medical terminology we're about to get into, we need to see what's happening mechanically to create that fiery sensation in the first place. Okay, let's dive into this. Section 1. The stomach's one-way door. To understand normal digestion, to understand what goes wrong, we really need to understand how the body is supposed to work. The journey your food takes follows a pretty specific checklist. It starts in your mouth. When you eat, food passes from your mouth down into your esophagus. Now, this is a powerful muscular tube that basically serves as a highway leading directly down to your stomach. But right at the very end of that tube, just before the stomach, is an absolutely crucial piece of anatomy, the lower esophageal sphincter. Think of the lower esophageal sphincter as a highly specialized one-way door. This ring of muscle acts as a gatekeeper. When food comes down the esophagus, this sphincter opens up wide to let the food drop right into your stomach. But here is the vital part. Normally, once the food is through, it stays completely closed. That firm seal is what prevents the contents of your stomach from flowing backward. It keeps your food and your harsh stomach acids exactly where they belong. Section 2. When reflux becomes a disease. Let's look at the critical threshold. This brings us to gastroesophageal reflux, or GERD. This happens when that one-way door, the sphincter, becomes weak or just too relaxed. It simply doesn't close all the way. And because that seal is broken, the contents of your stomach are allowed to reflux, or basically leak back up, right into your esophagus. And remember, your stomach is full of really strong acid. When that acid hits the delicate lining of your esophagus, it irritates it, causing that painfully familiar burning feeling in your chest that we all know as heartburn. Now, what's really interesting here is the critical frequency threshold. Experiencing GERD, that occasional reflux, just once in a while, that's a pretty common nuisance. But if this mechanical failure happens more than twice a week for a few weeks, it escalates into a chronic condition, gastroesophageal reflux disease, or GERD. Frequency is the absolute key differentiator here between a passing discomfort and a true mechanical malfunction. Section 3, the hidden dangers of GERD. Let's explore what happens when it's left untreated. So the escalation arc here is actually quite striking. If you just leave GERD untreated, your esophagus ends up enduring constant acid irritation, and your esophageal lining is definitely not built for that. Continuous exposure to stomach acid physically damages it, leading to a condition called esophagitis. This is where the lining of your esophagus becomes severely inflamed and irritated. If that chronic irritation continues, it leads to esophageal stricture. I want you to imagine a tube that is just constantly getting inflamed and damaged. Over time, that structural damage causes the muscular tube of the esophagus to physically narrow. It literally becomes too narrow, which, as you can probably imagine, is going to cause some pretty significant structural problems for your digestive highway. And get this, the damage isn't just contained to your throat and chest. Surprisingly, stomach acid can be incredibly far-reaching. Because the acid is constantly leaking up, GERD may actually cause you to breathe stomach acid right into your lungs. No way, right? But breathing in acid can trigger an alarming array of respiratory issues. We're talking asthma, chest congestion, hoarseness, wheezing, all the way up to laryngitis and even pneumonia. But perhaps the most urgent complication is a condition called Barrett's esophagus. This is a profound and frankly scary cellular change. Because the lower esophagus is being constantly bathed in acid, the body actually tries to adapt, and the cells lining your lower esophagus are replaced with cells that are similar to those found in your intestine. Now, why does this matter? Because this specific cellular mutation significantly increases your risk for developing cancer in your esophagus. This is exactly why chronic GERD just cannot be ignored. Section 4, surprising causes and triggers, pressure, habits, and anatomy. So what actually causes that lower esophageal sphincter to fail in the first place? It really comes down to pressure, habits, and anatomy. Some of the most common underlying triggers might surprise you. Conditions like being pregnant or being overweight put intense physical pressure directly on your abdomen. That upward pressure simply overwhelms the sphincter muscle. Then you have habits like smoking, which can weaken the muscle, and even certain medications you might be taking for totally different things, like allergies, high blood pressure, or depression, which can actually relax that crucial one-way door. Structural anomalies can also be the culprit. Take a hiatal hernia, for example. This is a condition where the upper part of your stomach actually moves up through an opening in your diaphragm. By physically shifting upward out of its normal position, the stomach completely compromises the integrity of that one-way door mechanism. That makes it way easier for stomach acid to bypass the sphincter and come right up into your esophagus. Section 5, recognizing the symptoms. Let's talk about listening to your body. How can you properly identify if your occasional reflux has escalated into GERD? Well, this brilliantly illustrates the difference. While the most obvious warning sign is traditional heartburn, GERD possesses some surprisingly stealthy symptoms. You might experience nausea or even problems swallowing due to that narrowing we talked about earlier. You could have unexplained bad breath, a persistent sore throat, hoarseness in your voice, or regurgitation, which is literally bringing food back up. It's not always just a burning chest, guys. Identifying these symptoms, whether it's the obvious heartburn or the stealthier signs like bad breath and hoarseness, is your absolutely crucial first step. Because GERD is definitely not a condition you want to leave unchecked. Recognizing these patterns happening more than twice a week is vital. Please, if this sounds familiar, talk to your healthcare provider to find out more and get professional medical help. So I'll leave you with this. Is your heartburn trying to tell you something? The mechanics of our bodies are just fascinating, but they require us to listen when the internal alarms go off. Don't just dismiss the fire in your chest. Listen to what your digestive health might be urgently trying to communicate to you. Thank you so much for joining me for this explainer. Stay curious and keep listening to your body.